Good afternoon. This is Dr. Thomas Klein. As you know, I'm in Raleigh, North Carolina. I'm the spokesman for the National Pain Council. And I want to let you know that our work basically is revolving around finding enough data to support a counter position to the position supported by the CDC, the Physicians for Responsible Opioid Prescribing, and the DEA, our federal drug police. All three of those are working together to put forth the same message, which is overprescribing causes more junkies, more heroin addicts. And it's not true. So we are working on showing people why it's not true. It's not good enough for me just to say it. That's not the way we operate. So we will be putting things in writing, and then I will be discussing them in these sessions. But you are free to contact us with ideas, suggestions. We can't really take a lot of cases because we don't know any doctors in this country that are taking pain patients. And if they do, they keep it a secret because they'll be flooded. This has kind of reached a point where there are going to be no doctors or nurse practitioners in the United States prescribing opiate pain medicine, which is the goal of the trifecta, DEA, CDC, and PROP, the Physicians for Responsible Opioid Prescribing. It's interesting that the title of the group that provides most of this negative information is in itself gaslighting. Physicians for Responsible Opioid Prescribing implies everybody else is doing it irresponsibly. And this is a topic we're going to bring up time and time again. What is safe prescribing? What are the suggestions being put forth to cut down on overdose deaths and on addiction? Because we've been trying them now for 6 years since the CDC guidelines came out in 2016. They haven't worked. How many more years? How many more people are going to be screwed of the 10 million people with rare painful diseases who require daily opioid treatment with pain medicines? 7 million of those have already been taken off with ruined lives. So we're going to talk about an aspect of the trifecta, which is CDC, PROP, and DEA. And we're going to talk about the DEA and PROP together, their contribution to getting rid of doctors and making life miserable for patients. It was about, 7 or 8 years ago when the Brandeis University Heller School responded to the DEA, who wanted somebody to file a grant in order to start up a national surveillance system of all doctors and patients that take opiate pain medicines. The two people accepting the grant of $14 million from the DEA/DOJ, and remember that the Department of Justice is not separate from its police forces, which is unusual. The DEA is kind of a branch down the hall. And that's why when the DEA is asked to go to Congress, frequently there are problems because they're not an agency. They're an administration. Administrations are different from agencies. If the DEA is part of the DOJ, then the DOJ is the boss. And the DOJ, Department of Justice, is the one that should be promulgating regulations, but they don't. The DEA promulgates regulations, which is odd. So here's how PROP and the DEA work together. So Dr. Andrew Kolodny and Dr. Paul Kreiner applied for this grant. It's not clear if there were other people applying for $14 million 7 or 8 years ago from the DEA/DOJ to develop a computerized system to track every single person in the United States who gets one pain pill or more. Then they collect data on the doctors who are prescribing. They do this without your permission. This is a secret surveillance system developed by doctors at PROP and by the police department at the DEA to, they claim, help doctors to ferret out people that are doctor shoppers. Well, the studies have shown, and here's one of them, that doctor shopping is a rare phenomenon among patients with chronic non-cancer pain. And this is written by some prominent physicians at university settings. So they point out that the reason for the computerized program, which we're now going to call the PDMP, which is the nickname for the program that tracks all these prescriptions. I called the folks at North Carolina. Do you know how many doctor shoppers they caught a few years back? 4. So they spent $1 million a year on this PDMP, signing up to it, and they caught 4. 2/3 of doctor shoppers are actually pain patients who are not getting enough pain medication, and they're shopping around, right? So cruelly, they get rounded up in the dragnet from the prescription drug monitoring program, the PDMP. It's got a different name in each state, but they're all the same. So if it's not for picking up people who are doctor shoppers, which are of course presumed to be criminals, then they claim that the doctor should be forced to check this. In many states have passed laws where they are forced to check the PDMP to see if their patients are getting medications from other doctors. That sounds like the Stasi. What, we're checking up on our patients to find out what pills they're taking? And it's only pills that the government is afraid of. Why is the government afraid of these pills? Because people will lose their minds and become a problem, and who knows, charge into Washington, D.C. and be riotous and dangerous. These drugs are called dangerous drugs. The old name for the department that is in control, the DEA, of drugs used to be called the Dangerous Drug Administration. Dangerous drugs. Whether or not they're dangerous is a fact that we need to clear up. The PDMP does not do that. They just assume that doctors who are prescribing a lot of pain medicines or overprescribing need to be arrested. And we will talk about this in more detail with actual cases. Doctors are being arrested and sent to prison. There's a minimum federal penitentiary time of 20 years because the only law they can use is the law for drug trafficking. There are no other laws that put you into prison in the federal system. Lots of local laws, possession and that sort of thing. So what the PDMP has turned into under the leadership of Dr. Kreiner is what they call unsolicited reporting to the police. So this means that the system at Brandeis University, ironically, Justice Brandeis of the Supreme Court, favorite topic was privacy, and here they are invading privacy at the Heller School. So now they are rounding up doctors who are prescribing too much, but the ignoramuses don't understand that a doctor who prescribes a lot of pills probably does so because they have a lot of patients. So they're going by dose, and you know what? The FDA, that's in control of all this stuff, doesn't buy into the dose. You can use any dose of any opiate if titrated, which means you slowly increase it. There's no dose limit for opiates. There's dose limits for most all drugs, but not opiates. So the PDMP is now an internal, secretive spy system out of Brandeis University that's spying on people based on their medical records. This is really bad. Thank you. Good afternoon.